Administering red blood cell (RBC) transfusions in pediatric intensive care units (PICUs) involves several potential pitfalls that can impact patient outcomes. Key considerations include 1. Overuse of RBC transfusions. Overtransfusion is a significant concern in PICUs. Studies have shown that up to 50% of children in North American PICUs receive at least one RBC transfusion during their stay. However, liberal transfusion strategies have been associated with increased risks, including higher mortality rates and prolonged mechanical ventilation. Implementing restrictive transfusion protocols can mitigate these risks and reduce unnecessary transfusions. 2. Inconsistent hemoglobin thresholds. There is considerable variability in the hemoglobin, or from HB thresholds, used to justify RBC transfusions. Surveys have reported transfusion triggers ranging from less than 7 GWH/DL to over 13 GWH/DL. This inconsistency can lead to both under- and overtransfusion. Adhering to evidence-based guidelines, such as those from the Pediatric Critical Care Transfusion and Anemia Expertise Initiative, TAXI, can help standardize transfusion practices. 3. Ignoring patient stability. Transfusion decisions should account for the patient's hemodynamic stability. For stable patients, restrictive transfusion strategies with lower HB thresholds, e.g., 7 GWH/DL, have been shown to be safe. In contrast, unstable patients may require higher HB thresholds to ensure adequate oxygen delivery. Tailoring transfusion decisions to the patient's clinical status is crucial. 4. Neglecting physiological indicators. Relying solely on HB levels without considering physiological indicators can be misleading. Factors such as lactate levels, oxygen saturation, and signs of shock should inform transfusion decisions. Comprehensive assessment ensures that transfusions are administered based on the patient's actual oxygen delivery needs rather than arbitrary HB thresholds. 5. Potential adverse effects. RBC transfusions carry risks, including transfusion-related immunomodulation, increased infection rates, and transfusion-related acute lung injury. Recent data suggests that donor RBCs may be inferior to native cells in delivering oxygen and may have negative procoagulant and immunomodulatory effects. Weighing these potential adverse effects against the anticipated benefits is essential in transfusion decision-making. 6. Lack of standardized protocols. The absence of standardized transfusion protocols can lead to inconsistent practices and variability in patient care. Developing and adhering to institution-specific guidelines, informed by current evidence and expert consensus, can promote uniformity and improve patient outcomes. Administering red blood cell (RBC) transfusions in pediatric intensive care units (PICUs)